Case study. Case study overview. A healthcare practitioner works at a culturally diverse community clinic in an urban area. The clinic provides primary care to a multi-ethnic and multilingual patients, with many below the poverty level. On a daily basis, the clinic is overcrowded and sees a high volume of patients. The wait time for acutely ill patients can be up to 2 to 3 days, and other routine appointments are up to 6 to 8 months. There are a high number of no-shows on most days, ranging from 20 to 40% that do not show up for their appointments. The practitioner's schedules are double booked to offset the no-show appointments. However, when the scheduled patients do show up along with the acutely ill patients, the clinic is unbearably overcrowded and chaotic. Additionally, patients are walking in during the lunch hour or late in the afternoon when everyone is getting ready to leave. Many English-speaking patients have better access to care, more likely to receive timely appointments because they are more demanding of the system and more readily keep their appointments. Some patients were surveyed for reasons not coming to appointments. Here are a few common reasons. A sick patient waited so long to be seen that she got better and didn't need the visit, or got worse and had to go to the emergency room. A patient did not have a phone, or his phone number changed, so he never received a reminder message the day before the appointment. A patient showed up for the appointment, but at the wrong date or time. He misunderstood because of language barrier. A patient was afraid to take off work and risk losing her job. It would have been much easier for her to make an evening or weekend appointment. What went wrong in this clinic? The clinic is overcrowded because the practitioners' schedules are being double booked due to high rate of no-shows. Acutely ill patients are waiting too long to be seen, approximately waiting for 2 to 3 days, and routine appointments are scheduled out to 6 to 8 months. Most patients do not have access to equitable health care, and language and cultural barriers are an issue. Here are some proposed solutions and resolutions. Let's start with scheduling and appointments. Extend the clinic hours from 8 to 5 to 8 to 6 and open every Saturday from 8 to 1. Stagger lunches for staff from 11 to 12 and 12 to 1 to accommodate patient schedules. Implement open access scheduling, allowing patients to make their own appointments through the clinic portal for same-day appointments. Offer telemedicine appointments, allowing patients to seek out medical care while staying home to help decrease waiting room overcrowding. Some additional proposed solutions and resolutions are language and cultural barriers. Survey the various language and cultures the clinic serves. Short term would be to adopt and utilize a form of language line interpreter software via phone or video services. Research suggests 1 in 5 neighbors speak English. Long-term goal could be hire staff to accommodate languages and cultures to fulfill the needs of the community they serve. Additionally, train and educate all staff on the various culture beliefs and ethnicities to produce culture sensitivities and knowledge to communicate with the patients appropriately and competently. Lastly, provide posters, signs, magazines, or other reading materials to be available in the waiting area to reflect the cultural beliefs of the community. Additional proposed solutions and resolutions with access to health care. Some suggestions are utilize the sliding fee discount program using the federal poverty levels to accommodate and decrease office visits for low-income and cash-paying patients. Implement CHDP Gateway program to allow children ages 0 to 18 years of age that do not have health insurance to receive well child exams and routine vaccinations for school requirements. Implement Family Pact. Family Pact is a state-funded program with minimal requirements to receive pap smears, birth control methods, STD testing, and treatment covered by the program. Transportation can be provided through managed care health insurance plans offering free ride services to any medical appointments via Uber or Lyft. Lastly, offer free bus passes. Possible barriers from proposed solutions. First one, finding, hiring, and keep multilingual staff. Secondly, pushback from some staff regarding the change in extending clinic hours regarding lunches and clinic being open on Saturdays. Time to train all staff and apply their knowledge to be culturally sensitive. And lastly, implementing programs in a timely manner such as telemedicine, open access, language line, and other programs. That concludes the case study. Thank you for listening, and there are references available.